I am Fiona Sempron and I am your student nurse for today. So, I am here to demonstrate the client position in the bed. So, ano po pangalan, ma'am?
Claire Christine.
Age po? Is it okay with you, ma'am, that I am doing a positioning?
But before that, I'm gonna check for the privacy of the client by closing all the windows, curtains, and the doors.
So before I start, let's sanitize our hands.
Prone position, the client lies down on the abdomen with the head to the side. The prone position is used primarily to assess the hip joint. Prone positioning is generally used for clients who require a ventilator or breathing machine. Clients with cardiac and respiratory problems cannot tolerate this position. This is prone position. In supine position, a small pillow may be placed under the head to promote comfort. If the client has trouble breathing, the head of the bed may need to be raised. This position allows the abdominal muscles to relax and provides easy access to peripheral pulse sites. This position is most often used for abdominal surgery, some pelvic surgery, open heart surgery, and most surgeries of the extremities. So this is supine position. Sims position, the client lies on the right or left side with the lower arm placed behind the body and the upper arm flexed at the shoulder and the elbow. The lower leg is slightly flexed at the knee while the upper leg is flexed at a sharper angle and pulled forward. This position is useful for assisting the rectal and vaginal areas. This is Sims position. Dorsal recumbent position. The client lies down on the examination table or bed with the knees bent, the legs separated, and the feet flat on the table or the bed. Areas that may be assessed with the client in this position include head, neck, chest, axilla, lungs, heart, extremities, breast, and peripheral pulses. The purpose of the dorsal recumbent position is to allow for examination of the head, neck, anterior thorax, lungs, breast, and axilla or the heart. This is the dorsal recumbent position. Knee chest position. The client kneels on the examination table or bed with the weight of the body supported by the chest and the knees. A 90-degree angle should exist between the body and the hips, and the arms are placed above the head. And a small pillow may be used to provide comfort. The knee chest position is useful for examining the rectum or often used for spine surgery. This position may be embarrassing and uncomfortable for the client. Therefore, the client should be kept in the position for as limited a time as possible. So this is knee chest position. Lateral position, left and right. In lateral position or side-lying position, the patient lies on one side of the body with the top leg in front of the bottom leg and the hip and knee flex. This lateral position is used for surgical access to the thorax, kidney, retroperitoneal space, and hip. This is the lateral position right. Next is the lateral position to the left. Lateral position to the left. Next is lithotomy position. The client lies on the back with the hips at the edge of the examination table and the feet supported by the stirrups. So it's because we're not in the hospital to properly demonstrate this position, so let's improvise in order to demonstrate this position. The lithotomy position is used to examine the female genitalia, reproductive tracts, and the rectum. The client may require assistance getting into this position. It is an exposed position and clients may feel embarrassed. These steps helps the patient sit up and move legs off the bed at the same time. Use proper body mechanics help prevent injury when handling client. And on the count of 3, gently raise the patient to sitting position. Ask patient to push against the bed with the arm closest to the bed. This allows the patient to help with the process and prevents injury to the healthcare provider. Sitting position. This step prepares the patient to be moved. Turn the patient on the side, facing toward the caregiver or a nurse. Assist the client to move close to the edge of the bed. Then, place one hand behind client's shoulders, supporting the neck and vertebrae. This provides support for the patient. Do not allow the patient to place their arms around your shoulders. This action can lead to serious back injuries. On the count of 3, instruct the patient to use their elbows to push up on the bed. At the same time as you're shifting your weight, gently grasp the patient's outer thighs with your other hand and help the client slide their feet off the bed to dangle or touch the floor.